Good evening, Mayor and City Council. So I'll go ahead and get started. Next slide, please. So the first slide is a review of the pandemic dashboard numbers. So the 21.6 represents the amount of new cases we have on a daily basis. The next statistic is 9.5. That is our percent positivity. In Suffolk, the state is at 6.3. So we are elevated above the state, but the recommendation is to be under 10. So we still are doing good with that. We have 0 new outbreaks, and the last number, 3.4%, represents the amount of cases we have in our healthcare workers, and that is an important number to keep low. In the event that we did have a surge in long-term care facilities or hospitals, we would want to know that our healthcare workers are doing well and not ill so that they could support our hospitals. Next slide, please. All right, vaccine update. As we know, we have 3 vaccines that have received EUA. That is Pfizer, Moderna, Johnson & Johnson. In Western Tidewater, we are mostly using Moderna and Pfizer with our health department vaccination efforts. They are both mRNA-based. Moderna is 2 doses, 28 days apart, and Pfizer is 2 doses, 21 days apart. Recently, Pfizer has been tested in children ages 12 to 15. EUA request for expansion is pending, so it is not approved to be used in those age groups yet. Trials that thus far look promising, 100% efficacy and robust antibody responses. Pfizer has also started trials in children ages 6 months to 11 years old. Next slide, please. As we know, Johnson & Johnson received their EUA at the end of February. This has a 72% efficacy in preventing moderate to severe disease. Method of action, an inactive virus protein induces immune responses to COVID. And yes, we are excited because this one is the 1 dose. And similar to the other vaccines, it can be stored in the refrigerator for up to 3 months. Recently, there was an issue at a production plant where 15 million doses had to be discarded, so there is a shortage across the United States. So we do not have it readily available in health departments, but we hope at the end of the, what month are we in? April. At the end of April, early May, we hope that they are able to ramp production back up so that we can be able to offer this 1-dose vaccine more often and on a routine basis. All right, next slide, please. All right, AstraZeneca. This one, the method of action is that an inactive virus protein induces immune response to COVID. It is 76% effective against symptomatic COVID and 100% effective against severe disease. It has not received, it has not been approved by the FDA in the United States, but I thought it was important to share because it is approved in the UK and some other countries. The FDA has requested that AstraZeneca provide large-scale results before they get their approval. All right, next slide, please. This is an oldie but goodie, just reflects how you have 2 types of immunity. You can get it through naturally getting COVID or getting the vaccination. And once again, vaccinations are important because this reduces the illness and death rates from the virus. And our goal is to reach herd immunity by vaccinating 70% of our population. All right, next. City vaccine distribution plan. Allocations are determined by the state. We started with Group 1A, that was our healthcare providers and long-term facility residents and staff. Then we moved to Group 1B, frontline staff, and as of last week, we have focused on Group 1C. This is our other essential workers, energy, water, housing, and construction, food service, transportation, higher education, IT, media, public safety, hairstylists and barbers, and other public health workers. Over last weekend, the health department staff and MRC called about 1,500 people in the 1C group to kind of see where they were at, and we used the information from the VDH statewide registration pool, and about a third of those, or maybe 25% of those, had already been vaccinated, and then there were a lot that just didn't answer the phone. So that just shows one of the efforts that we're taking to make sure that people are aware that they can get scheduled and that their time has come to be vaccinated. Next slide, please. Distribution plan. VDM supported CVC started yesterday. We are very excited. I think this slide should say 275 vaccines, 6 days a week. Chief Spicer will correct me in his presentation if I'm wrong. So Portsmouth, just to let you all know about some other CVCs in the area, just because they all kind of function similarly. Portsmouth has a CVC that started March 6th, and then Norfolk has one that started March 31st. And it's good that people have options, because we know in Hampton Roads, people might work one place and live another. So we're really just trying to ramp our numbers up. The Virginia as a state is set to move into phase 2 as of April 18th. Over the next 2 weeks, you will see a lot of the districts give press releases that they are officially into this phase, and that means general population. So we're excited about that as well. Next slide, please. All right, so this is the most important slide. What we've seen over the past couple of weeks is that we've had a decreased response to the invites that we send out on an almost daily basis to come to our vaccination clinics, those that are run by the health department. So we really want to encourage the public, encourage all of our city officials to post this, share this. There are 2 options on how you can register. There is a 1877 number, and if people don't have email access, they can use that. You can actually register over the phone now. You can be connected with a clinic that's close to you and get an appointment. So that is a really good resource that we're trying to get out. What else? Oh, and another thing that we've seen is when we do call and try to make appointments, we have to remember Suffolk is such a huge district. People aren't as willing to drive from one part of Suffolk to another, but we encourage people that if it is not a true hardship, please try to take that first clinic that's available, because it does behoove you to get this vaccination as soon as possible, especially before it comes open to the public, because then there'll be even more demand. So we just want to encourage people, if it's not a hardship, please try to go to that clinic that is being offered to you. All right, next slide, please. Our partnerships. Previously, we did have our local call center that was supported by the city, and that was very helpful. At the end of March, we had the Bayview Second Dose Clinic that served about 2,500 doses. EMS partnership has allowed us to expand our efforts. They have assisted with us doing private organizations or businesses. There is also the Federal Pharmacy Partnership, Walgreens, CVS, I think is expanded to Walmart as well. We continue to partner with our local pharmacies and practices. And as of April 5th, Suffolk had administered 38,000 doses. So I think that's a pretty impressive number. Let's see. Next slide, please. All right, so vaccination equity. Out of the vaccinations we've given, about 3% have been in the Latino community, about 34% in the African American community, 58% in the white community, Asian community 2%, and others, those who are partnering with the Suffolk Coalition of Black Pastors. They have been sending us lists of people with their names and phone numbers, and we have been reaching out. We're going to work on a flyer. We've been reaching out to get them scheduled at our next event. We are going to work on a flyer so that those people also know there's a phone number, just so they know that there are multiple resources, so that if one resource fails, you can have a backup. In addition to that, this past couple of weeks, we did an event at Whaleyville, Hub 757, and East Suffolk Rec Center. All of those were really successful. I think it was like 500 at each one, at least. We also are going to start working with the ELITE team. This is a contract team from Virginia Department of Health, and they help with canvassing, outreach, engagement, education. Because the other question we have to ask is when people aren't pre-registering and becoming a part of the database, is there something we're missing? Is there something we need to share with them that might encourage them to be a part of the process? So we're really trying to approach the equity from all aspects. And we are going to continue to target those that have internet issues or lack of email. Next slide, please. All right. So this slide just goes over how we started in phase 1 and how we're kind of on that upward slope now. our vaccine amount is increasing, and that's helped support things such as the CVC. And we hope that as we get up to the top of the slope, that's where phase 2 is, where we can go into the general population. And then phase 3, the sea green part, represents how the flu shot is readily available everywhere. So that is the hope for the COVID vaccine. Once we've got our general population done and the vaccine is plentiful and available at grocery stores, pharmacies, your clinics, your urgent care, the hope is to eventually be in phase 3. And let's see. I think that is all I have. Any questions for me?
Thank you, Dr. James. Vice Mayor?
Thank you, Dr. James. Great presentation. Just a couple of questions. When they did the testing at East Suffolk and the Wheeler area, I know that's outlying areas, so are they going to be able to go back and get the second shot at the same time, at the same place?
Yes, Mr. Bennett. So basically, we call it our second dose clinic. So 28 days later, we're going to come back to that same place, same time. And we do have people who may not be able to fit in that same date and time to their schedule, but usually our team accommodates them with something very similar. So we do come back around that second 28 days. We call it our second dose clinics. Yes, sir.
Are we getting close to having walk-ups wherein the people don't have to be pre-registered in order to get the shot?
We're still working on plans for that. It is hard because you need almost 5 to 6 extra people to register. So typically when we register, because we are going off of the registry, we just kind of go through the system and check you in. Whereas if people are truly registering on site, it takes a little longer. They might have questions about the paperwork, but we are working on a process because we do see that's a need as well, because not everybody can sign up in advance. So that's definitely something that's our priority as well. Thank you, Mr. Bennett.
Okay, my other, I'm asking a lot of questions. As far as people answering the phones, how is that? I mean, I know you all are saying by appointment only, so a lot of people, are they answering the phone, or are you having the numbers where you think they should be?
So, for example, I was sharing that the staff and some of the MRC last week called about 1,500 people. I think they said a third of the people did not answer their phone.
Right, that's right.
So that's the hard thing about phones. And I mean, honestly, it can happen with emails too, right? But there is that gap of, are you catching someone at a time when they're at home? So that's something that we need to figure out a remedy for too, because we don't want people to be left out of the process.
Final question. Booster shots. Have you heard anything about whether or not this is going to come about in 6 months?
That's a good question. I know Pfizer did release that their vaccine, the immunity lasts for 6 months, but we have not got any updates on booster plans for how that would operate. But that's a good question, Mr. Bennett. I'll keep you posted.
Okay. That's all. Thank you very much for your presentation.
Goldberg.
Thank you. AstraZeneca, there's some studies or something they've been talking about in Europe especially, that it has some effect on blood clotting, causing that. I guess we're studying that to check to see whether that actually is the case or not. Or
I think they, that's why they want a larger scale testing trial. So based on the numbers of blood clots they had, it was the same amount that would happen in the general population. So it wasn't truly elevated, but they're wondering if, because that pool of people in the study was smaller, I think that's why the FDA wants a larger pool so they could see, is this just reflective of what would have happened in
anyway,
normal?
okay.
That's a good question.
All right, thank you very much.
Thank you, Mr. Bull.
Councilman Fawcett.
Dr. James, I just want to touch on a couple of things. You know who I am and what I'm doing at the Portsmouth location. This past week and a half, I've seen a lot of the 16, 17, and 18-year-olds coming in. Pretty good numbers. Can you touch on the fact that with the cutoff, why we did a 16 versus a 15, and the guidance between the 16, 17-year-old with the parent versus an 18-year-old that's considered an adult? I just want people to be clear, because that's a little tricky when these folks come to the site, and I just want to have that shared with the population.
Mr. Fawcett. So Pfizer is approved in 16 and up. So a lot of the messaging that the health departments events do is for Moderna, and that's 18 and up. But the CVCs can utilize all three. And it's not that the health department cannot utilize all three. We just mostly use Moderna. In events that we have for Pfizer, we do publicize it as 16 and up. But specifically for the CVC, they can do 16 and up because I think the major thing that the major vaccine they're using is Pfizer. They cannot do 15, even though that is being studied. That has not been approved yet by the FDA. And with someone 18 and up, they are considered an adult, so they would not have to have a parent there with them.
Exactly. You know, with the experience I've had is, a lot of these young people are getting appointments, but yet I still have people in the 1B category that are up in age 65 to 80 years old that are still waiting, that have not had an opportunity to be contacted, or they haven't got their appointment. The bad part is we're not doing the walk-ins right now because we'd get overrun by the walk-ins and it would cut those that do have appointments out. But the other part of this is you got a 78-year-old lady that I had the other day, precious as she could be, come to talk to me and said, look, I don't have a cell phone. I don't have internet. I got an old wall phone on my house. She lives by herself. She said she tried to register or did register but never got a phone call back. She could have missed it because of her age or whatever. She might have been doing something else. I made an exception to the rule to that. But the point is what has to be talked about is people are really struggling still to get those appointments. And you got a younger generation that came in the 1C that are getting those appointments, but yet we still haven't fixed the problem with the 1B folks. And even with that, I'm pushing 1,500 doses a day out the door, which is phenomenal, each week. So you figure that's 6 days a week. You do the math, that's quite a number of people. So somebody needs to just kind of reach out and maybe give us a window of somehow we could do some walk-ins somehow. I mean, I think it can be done, and I think we could look at that. But some people just have to have that opportunity because they just don't have the technology, or they're working long hours, or they may have missed it. They didn't get it on the cell phone. I mean, I've heard everything this last 5 weeks, and I hate turning people away because they don't have an appointment. So if you have any opportunity to reach out to VDH and say, hey, look, what can we start working on to help get these people that may have communication problems to get in, I think I'd appreciate that because I'm willing to do it, but I just got to have some guidance on it, you know.
Yeah, VDH, we can also work with VDM since they are mainly operating the
True.
CVCs. One solution that was discussed, I don't know if it's like the best, I think it could evolve, but if you'd like to keep a list of people who had to be turned away in Portsmouth or Suffolk, you could email it to me and we could get them connected with resources, but that's the short term.
Yeah, I wish I had the list the other day. I turned 300 cars out that I couldn't touch because I was overrun by the appointments. That's understandable, but
If you're able to keep a list in the future, if you connect it with me, I will reach out.
we'll see if we can do something to help facilitate that. But that's just a couple of points I brought up. And the age factor is a big thing because 15-year-olds think they can walk in and get a shot, and it's not going to happen. With the parent or without a parent, it's not going to happen. Thank you.
Councilman Ward.
Yes, thank you, Dr. James, for your information. Very appreciated. I just want to let you know that Tipper Bell had their second shot today up the northern part of Suffolk, and I attended both of them, and it was really packed with, like I said, when I see that situation like that, it just comes to my heart. And also, I want to thank 757 The Hub. They had theirs, right after Tipper Bell. So it's great to see that up in that part of Suffolk, and the attendance is really amazing with how many people coming out. Thank you so much.
Thank you, Dr. James, and thank you for everything you've done, everything you're doing. We're really progressing. I took a tour of the CVC that's set up at the Hilton Garden, Monday through Saturday, 8:30 to 5:30. It's amazing that you can staff it those kind of hours. Keep in mind that you do have to have an appointment, so I encourage everybody to get signed up with the health department. I mean, it works. I had my daughter-in-law do it, and within 2 weeks, she got a phone call. So it does work, and if you know people, ask friends, any of your acquaintances that may have difficulty with it, just help them get online and get signed up. So we definitely looking at the light at the end of the tunnel. So thank you very much.